The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, menopause. My first guest is an expert on the topic, Dr. Andrea Cole. Dr. Cole, welcome to the program.
Oh, nice to be here, Randy.
Now, we've had you on the program before, and you say a lot has changed. You're in a brand new center, very large center. Tell us about it. I mean, who's your typical patient?
Okay, so my center is in Encinitas. It's called Center for Age Management and Wellness.
Okay.
And it's something that I've wanted to create for a long time. So I've brought in other modalities. We have an acupuncturist, we have a chiropractor, I have an energy psychology person, we have thermography.
Okay.
With the idea being...
breast health. So you're
Right,
okay.
very much centered on breast health.
Interesting.
But the idea being that there are many things that I can use in my toolbox to help a woman or a man move to better health.
Okay, good. You know, I thought of you recently, and that's why we got you on the show. I was looking at a big flyer. One of the biggest anti-aging conferences here in California was in LA, and you were on the bill as a speaker.
I was.
So you do a lot of speaking. I mean, you
Yes.
teach other physicians what? What is your topic?
My topic is usually menopause, how to manage menopause. So all the bioidentical hormones, but really, and more. So I want to educate my physicians that there's much more to managing hormones than here's your estrogen, here's your progesterone, see you next year.
Okay. Now, and I know this is a big topic, but
is.
what's changed since, I guess I first met you, had you on the show probably 7-8 years ago.
That's right.
What's changed? I mean, do you look at it from a different perspective than you did back then?
Yes,
and if
I
so,
think-
how so?
I do. It's a much bigger perspective. So for me, it's been quite a journey. It's like peeling an onion. So first, I balanced the hormones, but that didn't give me the answer to the clinical picture. And then I looked at all the biochemistry.
All right.
And now we're looking at a number of different things, neurotransmitters. And really the big thing now is the connectiveness of everything. So the neurologic system and the immune system and the endocrine system, it's not separate like we were all taught in medical school, but they're so intertwined. And so what may present as an endocrine problem may have as its base an immune problem.
What about results? I mean, are you able to get better results than you could back then? I mean, relieve women of their symptoms, men of their symptoms?
Yes, and for example, I
Okay.
had a woman who presented in menopause with a lot of depression. So we balanced the hormones, the estrogen level's fine, but her brain doesn't work. So when
Brain doesn't work, meaning what? What does that
she
mean?
can't think, she's crying. I always say, if you're crying at commercials, you've got to come see me. It's time to adjust the hormones.
Okay.
But she's doing that. She's weeping. She's crying. She's driving down the street. She's crying. She's crying. She's crying.
Interesting.
So weepy, weepy, weepy. So we looked at her neurotransmitters, and her serotonin levels were very low. And if I can balance that, I can use a much lower estrogen dose in her, and she will do better.
Okay. Now, you explained that, this menopause. We were in the green room, and you were saying that women come, and I said, well, what does it mean to be in the menopause? I mean, what are women going through?
So I'm beginning to look at menopause a little differently. It's not just biochemical, but it's really about what do I want to create for the next 50 years. And some women it's like you're given a second chance. You
Second half of life, okay.
Second half of life. So maybe there's a loss. Maybe they're not where they thought they would be at this stage in their life. And they almost have to process this because it will bubble up in menopause. So any unresolved conflict or issues that you didn't take care of back in your early years, it's going to represent in the menopausal years.
So as hormones decline, that self-esteem issues, things like that will be amplified.
Absolutely.
I mean, that's kind of what you're saying?
Yeah.
Okay.
Absolutely. So now we have a program that begins to help women deal with kind of the loss of where they thought they would be, to create a room to bring in the life they want to live. So it's not just hormonal or biochemical, it's really much bigger. I mean, they really, women have to do some work and resolve some past things to allow themselves to become who they need to be.
At the top of the show, we didn't even know what to call it.
Right.
Because I was trying to narrow it just bioidentical hormones, and you say it's health.
It is.
It's about better health. But are you usually using bioidentical hormones when you're treating patients?
Oh, absolutely.
When a woman goes to you?
Always.
Okay.
Oh, well, yeah, very big on hormones. But really, it's not just hormones. It's really hormones and the immune system and the neurologic system and your emotions and your diet and your exercise and your thoughts. And so it's bigger. It's much bigger. And so we do all of that now.
You know, you told me a 75-year-old woman was in your office.
I love that.
A couple of days ago or something like that. Tell that story. It's a good one.
So, she's an older woman. She's been on hormones, but she complained of fatigue, no sex drive at all. So we talked about testosterone replacement in her. I look at her cholesterol and things like that because you have to be a little concerned with that. But anyway, I put her on her testosterone and saw her back a few weeks later. She just sat there beaming and bragging about her sex life.
Really?
Yeah.
At 75 years old?
At 75 years old. I was very impressed. A little jealous, maybe.
But is that common, though, that you can see that kind of a transformation or turnaround at 75 years old?
You can.
Female?
Not always. Women aren't as easy as men. We love men.
Okay. You say you love men in your office?
Oh, we love men in our office.
Meaning you like the male patients?
Yeah, they're not that they're simple.
Go ahead and say it. You might as well say it.
But they're a little less complicated than the
So it
women.
is simple.
Well, a little bit simpler.
Okay. So your program, okay, and we're talking about menopause, that there's a lot that women can do. I mean, when do you want to see them? I mean, when should a woman start seriously considering doing something about it?
I want to see the 25-year-old with PMS. I want to see that patient.
Really?
Absolutely. And I want to see the young person as well, because we can protect them as they get older. So we can start very early. But my typical patient is, 35, 45 to now 75.
And so this affects weight gain, it affects mood, all of those things. And what are the first symptoms? Okay, so you're saying 25 PMS.
PMS.
But isn't that just, so not everybody gets PMS?
No, not everybody has to have PMS. And so we can definitely manage that. And we look at imbalances. But again, there is that immune, neuroendocrine connection. So we look at that. And it may be an inflammatory problem. It may be a gluten problem. It may be, who knows, a sugar problem. But we can change specific things, including diet, and we can totally manage PMS.
Okay, what are the misconceptions, by the way, about what doctors like you do?
Well, one of the misconceptions is that you can accomplish things with just progesterone. Or, right? You can't, because it creates
That's
an
what
imbalance.
they tell me, by the way.
Oh, that's wrong.
Okay.
Yeah, no, that's
They
terrible.
say it's a feel-good hormone.
Not always.
All right.
Not always. As a matter of fact, I have women in my practice that don't tolerate progesterone at all. If I give them progesterone and they're depressed, it's going to make them more depressed.
Interesting.
So absolutely it's not always a feel-good hormone. And the other misconception is in PMS and perimenopause, where there's a lot of hormone chaos, it's always progesterone. That isn't true. That is not true at all. As a matter of fact, it may be a norepinephrine problem, so it may be a neurologic problem. That's what I'm saying. There's this interconnectedness going on, that it isn't just a hormone problem. It's this interconnectedness. And your thoughts have things to do with it as well. So it's big.
Well, I don't want to pretend or even act like that I know that much about it, but I want to. My basic understanding is this whole estrogen dominance. That estrogen, you may not have a ton of it, but in relation or the ratio with progesterone is thrown off.
Yeah, so
by just giving progesterone, you balance it out. But I guess it's not that simple.
No, it's not.
Interesting.
No, as a matter of fact, you could have a woman who has an iodine deficiency. She's going to present just like that woman with a progesterone deficiency.
But isn't estrogen dangerous for the breast, or dangerous for cancer, or dangerous for these things?
That's not. It's how you metabolize your estrogen that could be dangerous. So it's not the estrogen itself. And the studies after studies are now showing especially those older studies, it was the kind of progesterone that was being used. So it wasn't really necessarily the estrogen. But we can help a woman metabolize her estrogen. We can look at metabolites and change it. So it's not just estrogen, progesterone. It may be iodine. It may be related to her gut and she can't get rid of it. But we can take a breast, and what's really nice now, in my practice I have thermography. So I can take a breast that looks very dense and very thick and maybe at risk. I can do my intervention and we can document all of the changes I see biochemically, very visually and beautifully with thermography.
Now you have a select group of people that seem to go to you. I mean, you have a high-end group, but you have just regular people as well.
We
I mean,
are,
you have these type A,
We do.
super successful people
We do.
in San Diego.
We do. We love them because they come in very sophisticated. They've read everything. They know as much, maybe more than I don't know. But they know quite a bit. They're very well-educated people. And my job is to say, do you have it right? Is there something I can do for you?
Like, what do they want to do? They want to pick it up a notch?
Well, they might, but they may
So
want
they're well, they're feeling pretty good.
But they want to know where they are. They want the testing. You know, they want to know, are my vitamins right? Are my hormones balanced? You know, do I have inflammation? They want to know that. And so we can take whatever program they may come in on and say, okay, it's perfect. You've done a great job. No, you need a little bit more of something else. So we'll work with them, and they're wonderful. We want to keep them well as they age.
And the people, so you want to get more women, and there's thousands, tens of thousands in San Diego that are suffering that don't have to be, and maybe, is that the right word to say suffering?
Yeah,
are they really suffering?
They are suffering.
Really?
They are absolutely, they're miserable.
Like what? Tell me.
Oh, like a woman who comes in who may be a CEO of a big company. You know, she's multitasking, she's on target, and now she can't think. She can't manage. She's irritable, she's cranky, and she's just not functioning like she should be
Like the
functioning.
concentration starts going?
Oh, yeah.
But isn't that just part of age?
No,
Happens to everybody.
No, doesn't.
Okay.
Absolutely doesn't. No, because it's reversible. Because it's
Oh,
reversible.
so you've seen it
Oh, yeah.
where, with your protocols or therapies, whatever you're calling it, where that turns around.
Yeah, I had a patient the other day who came in and her relationship was a mess, just a mess. They were in therapy, she was crying, she just had no libido, and it was creating quite a strain in the relationship. We did what we do,
Okay.
saw her back in, so happy.
What do you mean when you say my program, Randy, and I'm paraphrasing a little bit, allows people to do more of what they want to do?
Because we give them back their enjoyment and the energy to do those things. So people in transition and middle age and that kind of thing, they'll come home from work and that is it. They are exhausted. They can't do anything more, and they just can't do it. So the thought of exercising or the thought of going out or whatever, they're just too tired. They're exhausted. They can't do it. They don't enjoy it anymore.
I always feel like everybody knows about bioidentical hormones by now.
They know some of it.
I mean, I feel like
Yeah.
most women, 44, 45, they're all on hormones. But you're saying they're not?
Well, no, they are, but they're not getting the full story. They are not getting the full story. They're not
Okay.
getting the full story about the safety. You know, there's this whole myth about the safety of bioidentical hormones. They are safer. They are hormones. So there's a way to make them even safer. So still, some of my colleagues will put women on now bioidentical hormones. See you next year. That's not right. That's not right. That's not giving them the information.
Do you get frustrated when you have patients that come to you and you see what other people are doing?
Sometimes.
Well, I mean, you lecture, you teach this
Yeah.
to other doctors.
Yeah. I don't care. I don't judge my colleagues or anything. I just want to pick up the pieces. I don't put my energy
You want to
there.
get them feeling better right away.
Yeah, I don't put my energy negatively.
And can certain people, I hear these stories about, women that they were depressed and anxiety and you name it, and all of a sudden, within,
we see
sometimes
it.
weeks, their
Weeks.
whole life has changed.
We see it all the time.
Really?
That's what makes my job so much fun. Because I can see it. I can see the improvement, not only in their ability to lose their weight and their ability to how they feel, but just they're all over energy. They feel so much better.
You seem to have a lot of energy. I mean, the way you move and the way, you're laughing all the time. So you do hormones.
Oh, I do hormones.
So you believe in
I
hormones.
couldn't be sitting here and speaking in full sentences if I didn't do hormones.
What are the benefits of estrogen
Estrogen,
when a woman needs it?
Estrogen has 400 jobs in the body. So when a woman comes in and says to me, how long should I take that? I say, well, what age do these jobs become no longer important? And again, with estrogen, now what's coming out, it's the timing. So within the first 10 years of menopause, if I start if I start a woman on estrogen, I'm going to protect her brain from dementia. I'm going to protect her heart from heart attacks. Women focus on breast cancer, but 400,000 women die of heart disease, 40,000 of breast cancer, and estradiol is very protective against heart disease early on in menopause. Okay, so we have a window of opportunity to intervene with
So
these
when
women.
should a woman get, because again, it seems like you guys are divided. I know you teach other medical doctors, but some people are just giving progesterone without estrogen. When should a woman get estrogen?
when
what are
she-
some of the symptoms?
Like when she needs it. Well, physically, we'll see the appearance of fine wrinkles above the lip. That's sort of a hint that maybe the estradiol is going down. We'll you have to look at their levels and things like that. But the weeping and the crying and the moods and the poor focus.
So that's just not giving progesterone. You're saying it may be an estrogen problem as well.
Yeah, you can't just always give progesterone. It's
So
an
give it in
imbalance.
combination? Estrogen and
Sometimes in a
progesterone?
perimenopausal woman, their lows are just a bit lower. They don't go as high as they used to. Maybe it's more extreme, so it's the rate of change of the estrogen. So you have to hold those women's hands and you give them back a little bit as they need it, and then you change their program as they change.
We're going to take a quick break. We come back. Take me through the process. What happens on day one? You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about feeling better in the menopause with new cutting-edge breakthroughs. We have Dr. Cole. Okay, for people just tuning in. Okay, so you lecture to other physicians on bioidentical hormones and things like prevention and weight loss and breast health. And I guess, you talk about it all, right?
I talk about it a lot.
Right. And so let me ask you a question about day one, your approach. A woman goes to, she presents, let's talk about the beginner. She's starting to have problems.
Okay.
I guess the over-the-counter soy is not working anymore, or whatever she's doing.
Right.
What goes on in your mind, and what do you want to know?
So they come in and I want to hear their story. So I want to listen to their whole story, all of their symptoms, all of their concerns. I want to know their life. I want to know what they're dealing with. I want to know what kind of stressors they're dealing with. So we listen. I do a full exam. I come up with what I think would be the best workup. But we also now introduce that patient to the acupuncturist. So if I have someone who comes in very stressed, well, I want them to leave my office feeling much better. So they may spend 10 minutes with my acupuncturist. I want them to meet our energy person, so they may have a complimentary session. And we certainly want to introduce them to our thermographer. And so
Thermography is imaging of the breast. Is that correct?
You can actually do a whole body thermogram. For example, if I have somebody who comes in with a lot of inflammation, and I'm saying, where is it coming from? Is it gut? Is it mouth? Where is it? Well, there's my map. The thermogram is the map of the body. It'll tell me what's going on. And so I can use that information. I can get a glimpse at that person on day one. What is going on with that person it's a wonderful tool.
And is the science there to back up that it's effective for
Absolutely.
diagnosis?
For early diagnosis of breast cancer, absolutely.
Okay, so you order, and depending on what they present, a variety of panels.
Right.
Blood, saliva, what are you doing?
Well, we do blood, we do saliva, we do urine, but there's different panels. So I may look at, certainly a first lab. We want to know what is their cholesterol, what is their blood sugar, et cetera. So we'll do all the normal things, but we do a big hormone panel. I do a salivary cortisol. I want to know where their adrenals are functioning, very important, especially, important in all of it, but in perimenopause, that's what changes first. We want to know their neurotransmitters now. I want to know sometimes.
You could test for neurotransmitters?
We can.
Like serotonin, dopamine?
We can, yep. We do a urinary neurotransmitter test, which is so beneficial to me. And it actually gives me a glimpse into, is there a degree of inflammation that may be driving their anxiety? So again, it's that interconnectedness. That is what's really new, the interconnectedness of all of these pathways.
So you order the panels, then they come back a week later.
That we order whatever we
happens?
need, and they come back, and then we begin to put their program together. And then we'll see them back in, and we'll follow it.
How soon do they start feeling better?
Oh, well, they should be feeling better before they come back the next time. So within a few weeks.
Within a few weeks?
Within a few weeks.
So in your program, you look at sleep. You want them to sleep.
Oh, absolutely. They have to sleep. So let's say a woman comes to me.
like sleep like 8 hours.
Yeah, because if she comes in and she's not sleeping and she wants to lose weight, she can't lose weight if she's not sleeping. I have to get her sleeping. I have to get her sleeping first.
Like 8 hours?
I don't know about 8 hours, but at least a good 6 to 8 hours are not waking up all night long.
So if you don't sleep a lot, you're going to...
That is a snowball effect. You don't sleep a lot, you're not going to be able to think, your neurotransmitters will go down, you will be more inflamed, your cortisol may go up, you're going to store your fat, you're going to be miserable. You have to sleep. Sleep is really, really important.
Now, what drives people to finally hit that tipping point where they have to see you? Is it depression? Is it anxiety? They don't feel like themselves?
You know,
What is it?
It's really interesting that, speaking of sleep, I had a patient who was on a sleeping pill, and he tried to stop it, and the rebound effect scared him to death. That's what brought him in. He was anxious, he was nervous, and it was a horrible effect, and it made him terrified of those medications. So that's what brought him in. But people will come in, women will come in because they just aren't functioning well, they're hot flashing, their skin changes overnight, they can't think, they're crying. Men will come in, they're not sleeping, they're anxious, they're worried, they go to the gym, they used to get some kind of result, they don't, their recovery time is down.
So we are out of time, but your final message to a woman that maybe is suffering symptoms of menopause, resistant, I don't want to do bioidentical hormones, I don't want to do this, I don't want to do that, or they're confused, period.
Okay. My message to that woman would be that to have hope that that there exists for them a program that's just for them that will begin to turn around their symptoms in a few weeks.
You've been doing this for a long time. How long have you been doing this, just around hormones?
I started with bioidentical hormones in 1994.
Okay, good. And you are, we should mention, board certified in anti-aging medicine. Mm-hmm. Not a lot of people boarded in that.
No, it's a new specialty.
Lately, I even tell people, I said, if somebody went through the trouble, because I've been to these conferences, to go through that fellowship, to go through that program, they're pretty serious.
That's right.
About this, because it's not easy.
Well, you have to fall in love with it. I fell in love with it early on.